right, so hey everyone, my name is Rachitha Kumar. I am a rising senior at Mission San Jose in the San Francisco Bay Area. A little bit more about myself. I worked as a research assistant at a COVID testing lab for the past 2 years. I'm also a musician, yoga teacher, and doula in training. I hope to be a physician that works with women, children, and families. And my topic today is racism and bias in reproductive health. So starting with some statistics, the US infant mortality rate is 71% higher than other Western developed countries. The maternal mortality rate for Black people is 43.5% as opposed to 12% for white people. And a Black parent with a college degree is more likely to die than a white high school dropout. On the right, we have a graph from the CDC showing infant mortality rates across different races, and we can see that rate is much higher for Black babies. I'd also like to take this time to acknowledge that I will be using the term parent instead of traditionally used mother to be more inclusive of transgender and non-binary people. So going into a little history, in the 1830s, the field of gynecology developed through experimentation on slave women. The most famous doctor who did this is Dr. James Marion Sims, also known as the father of gynecology. Sims did not use anesthesia on his patients and would operate up to 30 times on a single woman. Sims was not an exceptional practitioner. This was very commonplace of the time. Slaves were often the subjects of research, and consent to perform procedures on them was a deal brokered with the owner, not gained from the patient themselves. And then later we have the field of Negro medicine, which is an entire field of research dedicated to proving that Black people evolved from a different animal than white people and had the overall goal of proving Black people as scientifically inferior. And then in the 19th century, as more immigrants came to the United States, we have the eugenics movement, which labeled immigrants as having inferior genetics and discouraged and stopped them from having children through selective marketing of birth control or forced sterilization. On the right, we have a photo of a statue of Dr. Sims in Central Park, which was recently taken down. So the overall takeaway from this is that Black people and minorities have been dehumanized in medicine. Assumptions persist that Black parents are hypersexual, more tolerant to pain, and have thicker skin, and there's been an overall lack of bodily autonomy for these people in institutional settings. And bias science works its way into our current practice, which we'll get into on the next slide. But on the right, we have a nursing textbook from 2017 that teaches nursing students harmful stereotypes about minority patients. So a good example of bias in practice is the VBAC calculator. VBAC stands for vaginal birth after cesarean, and it's a standardized way of calculating the risk of having a vaginal birth after a C-section. So the calculator takes race into account, and if you identify as Black or Latinx, your score drops, meaning it's more risky to have a vaginal birth according to the calculator. So this was investigated by Dr. Darshali Vyas, who felt that inclusion of race was faulty. And she didn't actually find a clear answer as to why it was included, but she found one possible link being the pelvic type study. The study was carried out by Caldwell and Malloy, who defined 4 possible pelvic shapes, but then incorrectly claimed that the more primitive races or minority races had a shape undesirable for birth. Their investigation, their methods for coming to this conclusion used a lot of after the fact thinking and is overall invalid. So race itself is not a risk factor in birth. However, being Black, Latinx, or Indigenous correlates with higher risk for vaginal birth after a C-section. However, race is not the underlying cause. Insurance and access to healthcare have been found to be more accurate predictors of infant outcomes. And in countries like Canada and Sweden, it has been removed from the VBAC calculator altogether. The unfortunate effects of race's inclusion is that many parents have been pushed into procedures that are more invasive, riskier, and more expensive. So what can we do about this? Well, I really want to emphasize that the awareness of this problem has led to a lot of action, and it's a really great thing. So we have family autonomy and advocacy. A lot of parents, upon learning about poor maternal outcomes for minority groups, don't feel safe going to a hospital and opt to choose alternatives like a home birth, and they absolutely have the right to do that. They're usually assisted by a doula, midwife, or another form of birth worker who can advocate for them in a hospital or another institutional settings, or they can help them in exploring alternatives. And then we have community education and other programs which implement lifestyle changes. So their value is that if poor birth outcomes is a result of lifetimes of inequality, then methods to counteract them will also take lifetimes. They hope to put lasting changes in their communities through hosting workshops for pregnant people and what to expect during their pregnancies, sessions for fathers to learn about childcare, and connecting parents to local support system. There's also midwives and birth workers providing culturally informed cares to close a possible just disconnect between a patient and a doctor providing traditional Western healthcare. This is seen in Indigenous communities, as well as public health programs working to connect all these dots together. That's community programs, the hospitals, and support systems. And then we have legislation. A lot of legislation focuses on standardizing data collection to get a more accurate picture of the problem, as well as any potential progress being made. There's also funding programs to improve healthcare access, and then creating federal or state commissions of experts, basically to further investigate causes and find solutions. And then re-examining science. Again, this is where awareness comes into play. So now that you all know, now that I know, when we inherit the healthcare system, we can challenge and investigate what we're being taught and search for bias and inaccuracy in that. And then we have activist physicians who use their medical expertise to advocate for social change through working with nonprofits or lobbying for a bill to be passed. And they also bring awareness of bias into their everyday professional practice. So here are my sources. And if you have any questions, feel free to contact me at rachitha@gmail.com. Thank you all so much for listening.